Any model that CMMI, the Innovation Center of CMS, basically develops and launches, it is absolutely critical to have a couple of voices that basically weigh in those models. I always think the first voice that's critical is the patient. A lot of times we think about sort of the payer side, which of course is the federal government, CMS, and then maybe providers and others, private payers and others. But I think the first voice that always should be heard from and heard from loud and clear are the patients. I think that's really true in oncology and other areas of medicine. But in addition to that, it's critical that the providers have a voice. I think it's critical that the private payers have a voice. And I think it's critical that industry has a voice, whether it's something that has to do with the pharmaceutical side or whether it's something that has to do with the device side. I think those are very important. And of course, when I talk about providers, providers affected are not just individual practitioners or group practices, but hospitals as well too. And a lot of times we make that and think about that as being doctor-centric, but I think it's critical, especially when you're talking about oncology, that oncology nurses weigh in. I'd be delinquent if I didn't say that because my wife is an oncology nurse, but I really believe that, and I believe that other parts of the provider team need to weigh in. That includes pharmacists sometimes.
The process by which CMMI has developed these new models, and I'm most familiar with the oncology care model, which was recently an RFA was recently released for that model, had I think the most important stakeholders, and I'll just say in my view there are three. One is the payer, the second is the provider, and third, but not by no means the least important, are the patients. So patients were present. I think that for those models to succeed, there has to be harmonization between those three stakeholder groups.
It's really difficult to sort of assess and quantify how well the state innovation projects have been doing, especially the first round of those. And this is one of my biggest concerns with the Innovation Center. There's a lot of hype and there's a lot of things that come out CMS in terms of how well these programs are doing, but there's no depository or there's no place that you can go on a regular basis except when a press release is released and really understand how well some of the state programs are doing. I think there's a lot of innovation that can be done on the state level, especially there's a lot of innovation in terms of Medicaid, which is a program that is very much in trouble. We're trying to expand, but it's a program that's in trouble. So what I would like to see, and it's very difficult to sort of assess how these state programs are doing, I'd like to see more transparency, more accountability at that level in terms of that, when you especially when you consider how much money has gone to some of these innovation programs at the state level.